Good evening. My name is Jeff Phillips. I'm the chairman of the Guilford County Board of Commissioners. The Board of Commissioners and all our staff are working diligently every day to enhance the safety and health of all Guilford County citizens. The last few weeks have been some of the most unusual times for all of us, and clearly the COVID-19 health crisis is obviously one of the most challenging circumstances that most of us have experienced in our lifetimes. That said, there's so much good that is going on around our world, across our state, as well as here in Guilford County. Families, neighbors, co-workers, and communities are coming together like never before. We are and will remain very sensitive to the challenges that all of our citizens are facing in their own personal way as we continue to assess the spread of the coronavirus and navigate any future decisions on behalf of our citizens. Today, I would like to inform you of an encouraging new county partnership that will better serve the needs of our homeless citizens who are currently staying in our homeless shelters across the county during the public health crisis. Commissioner Kay Cashin and I began discussions early last week with Brian Hahn, the Executive Director of Partners Ending Homelessness, and Dr. Pamela Palmer, the Chairwoman of Guilford County's Continuum of Care, in an effort to work together toward practical solutions that would in large part be driven by our public health experts and the ever-critical CDC guidelines. We've been laser focused on quickly developing strategies that would significantly reduce coronavirus risk and community spread among our homeless friends, both in our shelters as well as those who may be staying outside. Those early conversations led us to involve our public health director, Dr. Yulia Van, along with our emergency management director, Don Campbell, along with Felicia Reed, with our public health department, to come together to solidify the county's commitment in addressing this very serious and growing concern. You'll hear some brief details shortly from Dr. Van, but suffice it to say that all hands have been on deck since our first team meeting, and this group has done an exceptional job of pulling together our strategy and all the necessary services and resources to bring us to this point. It's important to note that the Board of Commissioners is very committed to supporting these efforts throughout the duration of this health crisis, no matter how long that takes. I especially want to thank Brian Hahn and Dr. Palmer for their leadership, their passion and compassion, but mostly I want to thank them for the manner in which they've had a strong desire to work alongside our public health experts in this very critical time. I can't thank the COC enough for their desire and willingness to partner with the county. While there will no doubt be some hiccups and challenges along the way, we must all stick together in this effort. We must not allow the distractions of a few critics and naysayers to detract us from our focus to do all we can together to protect the safety and health of our homeless friends across the county, and at the same time doing everything necessary to protect the health and safety of the caregivers within each partner organization. We can do this. We're better together, and we'll get through this stronger together. At this time, I'd like to turn the podium over to Dr. Yulia Van, again, our Guilford County Director of Public Health.
Thank you, Chairman Phillips. Good afternoon. My name is Dr. Yulia Van, and I'm the Guilford County Public Health Director. With any public health or natural disaster emergency, those who experience homelessness are often more at risk for poor health outcomes or other trauma. The spread of communicable disease is much easier if there is lack of access to hygiene facilities or a safe home. This is why it is so important that our homeless citizens have access to appropriate housing and services during these times. The virus is spread through person-to-person contact, especially through droplets in the air produced by an infected person when they talk, cough, or sneeze. Symptoms can include fever, cough, and shortness of breath. The Centers for Disease Control and Prevention believe at this time that symptoms of COVID-19 may appear in as few as 2 days or take as long as 14 days after exposure. There are some who are asymptomatic, which means that they're not experiencing symptoms. However, they're still able to spread the disease. Guilford County government is concerned that people who lack ready access to a safe home and in many cases adequate health care will be especially vulnerable in this situation. In order to protect the vulnerable population, Guilford County has worked with many of our community partners to develop a COVID-19 continuum of care plan. This plan outlines a process to care for the homeless who have tested for COVID-19 and are now waiting for the results, and those who have tested and now are considered positive cases. A process of isolation is necessary for both of these situations. I'm going to quickly outline some of the points in our plan. A screening process for all those who are entering the shelter or who are leaving a hospital setting will be done. They will be referred to the Guilford County Division of Public Health, who will approve the isolation process and guide the individual through this process. Public health staff will explain the medical implications thoroughly to the patient, and they make arrangements for the client with an arranged hotel. Transportation will be provided by Guilford County Department of Social Services 24/7, 7 days a week. We will also deliver meals throughout the day, 3 meals a day, and these will be dropped off at the patient's door with no contact. They will also have access to the hotel amenities inside of the room, and they will also be helped through the help desk for any needs that they might have. They will be provided with phone numbers for critical services and resources in order for them to be able to reach out in case they need something during this time. Patients will stay in hotels. They will be provided with security, and that is being done in partnership with various agencies within our county. We will also provide lab testing for these guests if that has not been already done by our healthcare system. Hotels will have handicap accessible rooms in case that is also needed. We understand that there might be certain details of our plan that might need to be adjusted in time as we're going through this process, but we believe that we have a strong plan and that our homeless population will be safe and taken care of during these times. Chairman Phillips, thank you.
Thank you, Dr. Van, and thank you for your leadership throughout this public health crisis. I'd now like to ask Brian Hahn, again, the Executive Director of Partners Ending Homelessness, to share a few comments as well.
All right. Thank you, Chairman Phillips and Dr. Van, for your leadership and support of our effort as we respond to this COVID-19 crisis. Again, my name is Brian Hahn. I'm the Executive Director for Partners Ending Homelessness, and I represent approximately 40-plus agencies across Guilford County who strive every day to end and prevent homelessness. And about a month ago, as we began to wrestle with our response to this crisis, we knew we needed help. We knew we needed public health experts to partner with us in this public health crisis. We do housing, that's what we do, but we don't do public health. And so we sought the leadership of the county for public health. I want to just address a little bit of the strategies that we've been working on in collaboration with the county's leadership. The first is we understand that the best practice is to socially distance those on site as best as possible. Just like you and I, we need to be able to space ourselves apart from people. And we wanted to create that for those who otherwise maybe don't have the resources to do that. Our shelters have been actively working on that strategy, spacing out, some shelters even identifying other site locations so that we don't have 40, 50, 60 beds in one location. The second part of our strategy was that not if, but when this virus begins to affect our shelter system, we wanted to be prepared. We wanted to have a plan. And so we reached out to the county for help. We needed to identify a location where we could begin to address the needs of our residents who either are symptomatic of COVID-19 or were to test positive. I'm thrilled to say that the county has delivered on that ask of a location, as Dr. Van shared, that includes transportation, public health support, food, security. They really went above and beyond our ask for help. And in response, our network is going to bring the supportive services in place that are needed for this site to do this right and do it well. Mental health support, substance abuse treatment and counseling, case management, human services support, to not only for these folks to be temporarily in this space and to get well, but to have the services they need to stay healthy. So the county's bringing the public health strength, and we're trying to bring our human services strength together. Again, I can't highlight enough how proud I am and thankful I am for this partnership with county leadership. We have a county-wide mission. We don't represent just one shelter, we represent 12. And this plan that Dr. Van and her team has developed serves all our shelters. And so thank you, Commissioner Phillips, and thank you, Dr. Van, for your help in this effort.
Sir. Thank you, Brian. And again, thank you for your leadership. I'd like to, in fact, thank all the COC agencies who've been involved and their teams. And please know that you are all, including every one of our homeless friends that you serve, are in our constant prayers, and you have our support. With that, just a couple of final thoughts for our citizens. Please stay home as much as you possibly can. Be safe, stay healthy, have a blessed Easter holiday, and thank you for doing your part to protect yourself and other citizens. God bless you all.